talk about nutrition. So eating eating disorders includes obesity, anorexia, bulimia. Difference between anorexia and bulimia. Anorexia, distorted body image. Women with anorexia can have a distorted image control issue. They have lost control of everything in their life, and the only thing that they can control over is what they put in their mouth. That's anorexia. With a decrease of body fat and weight, GnRH decreases. Therefore, FSH and LH also decrease, leading to low estrogen. As a result, amenorrhea occurs and predisposes to osteoporosis, as if patient is postmenopausal. Anorexic people will eventually develop osteoporosis. Treatment convince person to gain enough weight to bring period back, not birth control. Such a first step in management of HP diabetes is weight loss. Okay, as you lose adipose, you upregulate insulin resistance. In anorexia, usually die due to cardiac disease, heart failure, heart just stops. Oh, cannot believe like that. Now talk about difference between anorexia and bulimia. So anorexia already know. Bulimia nervosa, metabolic alkalosis. This is a metabolic alkalosis, so which is a high bicarbonate and which is high pH and due to metabolic. So it's not only a body image problem. They can be obese, normal or thin. It's not body image problem, huh? So okay, keep in mind that the anorexia which is body image problem, but bulimia nervosa that's not body image problem. They can be obese, normal, or thin, no weight issue. However, they binge. Binge stands for eat a lot, cause bulimia nervosa. Then force themselves to vomit. They eat and then they vomit. Anorexia, which is anorexia control. They lose weight, something like that. They don't eat how much. Bulimia nervosa, which is this one, the binge, which eat a lot. Force. Then after eating, they force themselves vomit. Vomit so acidic they can cause the teeth problem. So picture of the boss from vomiting wear down animal on teeth. So brownish stuff. Sing on teeth is just then dentin and time. So erosion sing on teeth. So metabolic alkalosis from forced vomiting will be seen. Metabolic alkalosis is bad because there is a left shift curve and the compensation is respiratory acidosis, opposite with the metabolic alkalosis. So they cause respiratory acidosis, CO2 increase. So patient with drops of PO2, therefore they get hypoxia with metabolic alkalosis, and the heart do not like that. The heart already with low oxygen, so we'll get PVCs, premature ventricular contraction, RRT, phenom, then VFib, then death. Therefore, metabolic alkalosis is very dangerous in inducing cardiac arrhythmias, and this commonly occurs in bulimia nervosa due to forced vomiting. Patients can also vomit out blood, cause Mallory-Weiss syndrome, tear in distal esophagus or proximal stomach. I'll talk about patient with Borhave syndrome, which is the worst in the syndrome. So there is a rupture in air and secretions from the esophagus get into the pleural cavity. The air will dissect through subcutaneous tissue, come around the anterior mediastinum, which leads to Herm- Hermiman's crunch. Also, when doctor looks at the patient's chest, put a stethoscope down, and you hear crunch. The crunch, the air that has dissected through interstitial tissue. Boy syndrome, which is worse. In the syndrome with the rupture in air and secretion from the esophagus get into pleural cavity. The air will dissect through subcutaneous tissue, come around the anterior mediastinum, which leads to Hemiman's crunch observed when doctor looks at patient's chest. Push the stethoscope down and you hear the crunch. The crunch is air that has dissected through interstitial tissue up into the mediastinum, indicating that the rupture occurs in esophagus. This is another common thing in bulimic. So there are two things important in bulimia nervosa. Number one, which is metabolic alkalosis. Number from vomiting, which can induce arrhythmias. Number two, which is a Borhave syndrome. Borhave syndrome, which is something a secretion from esophagus get into pleural cavity, and then we put stethoscope. We heard the sound crunch. The air will dissect through subcutaneous tissue, come around the anterior mediastinum, which leads to Hemimus crunch. Observe when doctor looks patient chest, puts the stethoscope down, and you hear crunch. The crunch is air has dissected through interstitial tissue up into the mediastinum, indicating that a rupture occurs in esophagus. This is not a common thing in polemics. Now, obesity. With obesity, using the different method, BMI, kilogram in the body weight, divided meters in body height square. If your BMI is 30 or greater, then you are obese. If your BMI is 40 greater, it's a morbidly obese. Main complication of obesity, hypertension. So with hypertension leads to left ventricle hypertrophy and potentially heart failure. Most common cause death in hypertension is cardiac disease. Other complications of obesity include gallbladder disease, cancers with a loss of adipose. You aromatize many 17 ketosteroids like androstenedione into estrogens. Therefore, will hyperestretism. All obese women have a hyperestretism. You are at risk for estrogen-related cancers, for example, breast cancer, endometrial carcinoma, colon cancer. Obesity, okay, like that. Talk about malnutrition. Malnutrition, protein calorie malnutrition, which is marasmus, so marasmus, and kwashiorkor. Now, malnutrition, which is technically this is a protein calorie malnutrition. Number one, marasmus is a total calorie deposition and wasting away the muscle. However, have a chance of survival if they get food. So kwashiorkor, which is a problem, gonna die. Have a carbs, but no protein. Also have anemia, cellular immunity problems. For example, no reaction to HES. Low albumin levels, ascites, fatty livers. So fatty livers, okay. So these kids are apathetic and needs to be force fed. Therefore, kid with kwashiorkor is more likely to die than child with the marasmus. Symbol: kids with anemia, flaking, dermatitis, reddish hair with a copper deficiency, kwashiorkor. So low protein get edema, flaky, dermatitis, reddish hair, copper deficiency, kwashiorkor. Now talk about vitamins. Difference between fat and water-soluble vitamins. Fat-soluble vitamins dissolve in fats, indicating that they are taken up by chylomicrons. The chylomicrons will have ADEK vitamins because these are the fat-soluble vitamins. Fat-soluble are more likely to be stored in fat, so the toxicity is much greater because if it is water-soluble, we just pee it out. Most common cause bright yellow urine. Vitamins. Fat-soluble hematotoxicity much more greater than water because if water-soluble vitamin toxicity, we just pee it out. You know, most common cause bright yellow urine, which is bright yellow urine. These vitamins. Uh, Now, water-soluble vitamins, so except IDEK, that they are, which is vitamin B, vitamin C, something like that. The water-soluble vitamins, all of them, these are cofactors for biochemical reaction. Oh, very important, huh? Vitamin C, things like that. Now talk about vegetable vitamins. Vitamin A function very important in children for growth and can have failure to thrive in vitamin A deficiency. Very important in eye rhodopsin within the eye. And the first sign of vitamin A deficiency is in night blindness, which is called notolopia. Vitamin A also prevents squamous metaplasia. Example of vitamin A deficiency: eye with the squamous metaplasia, goosebumps on head, on the back of the arms, called this a follicular hyperkeratosis. Eye is aligned with the cuboidal epithelium. When you get squamous metaplasia, you get white spots on the eye. If it become extensive, grow over eye, and can lead to softening of cornea, keratomalacia, and leads to blindness. Second most common cause blindness globally, vitamin A deficiency. Most common cause blindness globally, trachoma. Most common cause blindness in USA, diabetes. Therefore, vitamin A will prevent squamous metaplasia. If you have vitamin A deficiency and a non-smoker, a person can end up with squamous metaplasia, immense stem bronchus, and bronchogenic carcinoma. So, second most common cause blindness globally, this is vitamin A deficiency. Most common cause blindness globally, this is trachoma. Most common cause blindness in USA, which is diabetes. Most common cause blindness in globally, which is trachoma. But most common cause blindness in USA, this is diabetes. The second most common cause blindness in globally, which is vitamin A deficiency. Wow. Therefore, vitamin A will prevent squamous metaplasia. If you are vitamin A deficiency and a non-smoker, a person can end up with squamous metaplasia, immense stem bronchus, and bronchogenic carcinoma. Oh wow, vitamin A deficiency can cause squamous metaplasia and then end up with in the bronchus, bronchogenic carcinoma cancer. Vitamin A deficiency, they have some kind of sign we call this goosebumps on back of the arm, called this follicular hyperkeratosis. And in the eyes, lie with the cuboidal epithelium, you get squamous metaplasia, you get white spots on the eyes. So get the white spots on the eyes like that, called this cuboidal epithelium. And in the back of the arms, they call this follicular hyperkeratosis. And eventually also they have squamous cell carcinoma of the bronchus, called the bronchogenic carcinoma. Vitamin A deficiency. Huh? So vitamin very important. Huh? Of course, besides that they can cause blindness. Huh? So the white spot extensive, the overgrown the eye leads to softening the cornea, keratomalacia. So it leads to blindness. Second most common cause blindness in globally, which is vitamin A deficiency. The most common cause of blindness in globally, which is trachomia, and most common cause blindness in USA, which is diabetes. So that's why control diabetes very important, huh? Now talk about the toxicity vitamin A. So toxicity of the vitamin A, they call hypervitaminosis A. So this a big game hunter. They eat the bear liver and they cause that liver and get extremely headaches, increase the vitamin A, so causes cerebral edema, also get papilloedema, so which cause a headache, can also lead to herniation and death. There is also an increase in retinoic acid used from treating acne and acute progranulocytic anemia. Treatment the acne a lot, they can get toxicity of vitamin A. The retinoic acid toxicity can lead to severe liver toxicity. Therefore, hypervitaminosis of vitamin A affects two areas: cerebral edema, brain, number two, which is liver. Example is if have young lady patient on retinoic acid for acne, need to check liver enzymes and ask for headaches. Can be developing papilloedema or cerebral edema related to vitamin A toxicity. Massive amount of vitamin A in their livers, and hunter dies with massive headaches or liver failure. So toxicity vitamin A affect to liver, cerebral edema. Okay, and number two, which is liver. Young lady use treatment acne so they can cause need to check the liver because it overdose toxicity use a long time. Check liver enzymes. Ask for the headaches. Cause cerebral edema. They cause papilloedema. Check liver enzyme. Check for headache and development papilloedema or cerebral edema related to vitamin A toxicity. So massive amount vitamin A in their liver, and the hunter dies with massive headaches or liver failure. Now vitamin D very important. So most common source of vitamin D is from sunlight. Cholesterol is the main component of our cell membranes, starting point for making biosalts and bile acids. So first compounds that starts the synthesis of steroids hormones in the adrenal cortex. 7-dehydrocholesterol in the skin is photoconverted to vitamin D. Therefore, we need cholesterol. Makes bile salts, hormones, cell membranes, and vitamin D. Source: sun is the most important source of vitamin D. Take baby out to expose the sunlight. No vitamin D or vitamin K in the breast milk. Therefore, must be supplemented, exposed to sun for vitamin D. So synthesis of vitamin D reabsorbed in a reabsorbed in the jejunum undergoes two hydroxylation steps. So first is in the liver where it is 25 hydroxylated, and the second is in the kidney and is 1 alpha hydroxylase, where hormone put 1 alpha hydroxylase in the proximal tubule, PTH. PTH is responsible for synthesis of 1 alpha hydroxylase and synthesized in the proximal tubules. So ACE is from the endothelial cells of pulmonary capillaries. Erythropoietin is from endothelial cells of peritubular capillaries. 1-alpha hydroxylase is the second hydroxylation step, and now it is active. The first was in the kidney. So 1-alpha hydroxylase in what synthesis of vitamin D reabsorbed in the jejunum undergoes two hydroxylation steps. First, this is in liver, where liver which is 25 hydroxylated in the liver. The second, which is in the kidney, which is 1-alpha hydroxylase. 25 hydroxylase, which is liver, and 1-alpha hydroxylase in the kidney. So what hormone pushes what hormone push 1-alpha hydroxylase in the proximal tubule? PTH. PTH is responsible for synthesis of 1-alpha hydroxylase and hydroxylase and A synthesized in proximal tubule. ACE is from endothelial cells, pulmonary capillaries. Erythropoietin is from endothelial cells, peritubular capillaries. 1-alpha hydroxylase is the second hydroxylase step, and now it's active. The first was in the kidney. But they say the first was in the liver, 25 hydroxylase. Yes, I need to put question mark right here. Now, vitamin D function. Vitamin D function reabsorb calcium and phosphorus from the jejunum. So it has to reabsorb both of these because its main job is mineralize bone and cartilage. Have to have appropriate solubility products to be able to do that. Calcium and phosphorus are necessary to mineralize cartilage and bone, like osteoid making bone. Therefore, it makes sense to reabsorb calcium and phosphorus because it needs to make sure that both of them are present in the adequate amounts to have the adequate solubility products to mineralize bone. PTH, parathyroid hormone functions, is somewhat related to vitamin D metabolism. So it helps last step for hydroxylation of vitamin D synthesis. So number two, PTH will lead to reabsorption of calcium in the early distal tubule. This is also where sodium is reabsorbed, and thiazides block this channel. At that location, there is a calcium channel. PTH helps reabsorption of the calcium in this location. Calcium has to take turns with sodium, usually more sodium, reabsorbed. Therefore, calcium has no sneak-through channel with help of PTH. Therefore, with high size, sodium is blocked, leaving the calcium channel completely open, and the high size will lead to hypercalcemia. Therefore, use a calcium stone formers. Most stone formers have hypercalciuria. These patients have too much calcium in their urine. When they are on thiazides, the drugs take calcium out of the urine, so they do not form stones. PTH will decrease reabsorption of phosphorus in the proximal tubule and decrease the reaccumulation of bicarbonate too. So PTH is parathyroid hormone. Parathyroid gland function is somewhat related to vitamin D metabolism. Or parathyroid also affect vitamin D metabolism. It's a last step on hydroxylation vitamin D synthesis. PTH will lead to reabsorption of calcium in the early distal tubule, the kidney. This is also where sodium is reabsorbed, and thiazides block this channel. At that location, there is a calcium channel. PTH helps reabsorption of calcium in this location. Calcium has to take turns with sodium. Usually more sodium reabsorbed. Therefore, calcium has to sneak through channel with help the PTH. Therefore, with thiazides, sodium is blocked, leaving the calcium channel completely open, and the thiazides will lead to hypercalcemia. Therefore, used in calcium stone formers. Most stone formers have hypercalciuria. These patients have too much calcium in their urine, so when they are on thiazides, the drugs take calcium out of the urine, so they do not form stone. PTH will decrease reabsorption of phosphorus in the proximal tubules and decrease the reaccumulation bicarbonate too. Vitamin D and PTH and how they work together. Vitamin D's main function is mineralizing bone, and also blast bone builders are involved with this process. Therefore, the receptor for vitamin D is located on the osteoblast. When vitamin D hooks into the receptor, it's called release alkali phosphatase. So when you are growing bone or healing in fracture, you expect to see the increased alkali phosphatase, which makes the appropriate solubility products to mineralize cartilage and bone. Knowing that PTH breaks down bone maintains calcium level in the bloodstream, you would think that its receptor would be on the osteoclast. Cell normally breaks bone down. However, only one hormone has a receptor on osteoclast, and that is calcitonin. When calcitonin hooks into the osteoclast receptor, it inhibits the osteoclast and therefore is used to treat hypercalcemia. Calcitonin also used in treating osteoporosis. The receptor for PTH is on osteoblast, but not sharing the same one as the vitamin D. When PTH hooks on the osteoblast, it releases interleukin 1. Another name for interleukin 1 is osteoclast activating factor. Osteoclast, which is break, they break the bone house. Other function of interleukin 1 also involved to favor. Remember mnemonics, which is hearty bone steak. Cái lại that heart, which is favor, which is interleukin 1. T, which is interleukin 2, which is lympho T. Bone, which is B, hearty bone. Interleukin 3, which is lympho B. Things like that. Okay. So another function of interleukin-1, which is favor, stimulates the antibody synthesis and B cell stimulation. Interesting. I thought it's a B, which is interleukin-3. So interleukin-1 release from osteoblast. What? Always before they said osteoclast. Another name for interleukin-1 is osteoclast activating factor. Right here it said interleukin-1 activates osteoclast via interleukin-1 release from osteoblast. Oh, interesting. So then osteoblast, which one release interleukin 1? You're confused. When PTH hooks on osteoblast, then osteoblast release interleukin 1. Okay. So then interleukin 1, also another name, they call this osteoclast activating factor. Ah, release from osteoblast. Osteoblast. Osteoblast, which is the cell to make the bone. Osteoclast, which is the cell to rupture the bone, break down the bone. So, interleukin 1 released from the osteoblast. Okay, keep in mind that. So, interleukin 1 activates the osteoclast via interleukin 1 release from osteoblast. And osteoclast is signal to break down bone, đó like we discussed earlier. To maintain when they break down the bone, then they release the calcium level in the bloodstream. So sex hormones keep interleukin 1 in check. In women, estrogen levels keep a check on interleukin 1. Do not want too much osteoclast activation. In men, it is testosterone that keeps interleukin 1 in check. So push inhibitory effects on interleukin 1 release from osteoblast after PTH hooks in. Therefore, in women, can see why they get osteoporosis, lack of estrogen, interleukin 1 not in check, and breaking more bone down than making. This is a mechanism of postmenopausal osteoporosis. PTH is more involved in maintaining calcium levels in our blood, while vitamin D is more involved in mineralizing our bones and cartilage. So, sex hormones keeps interleukin 1 in check. In women, estrogen levels keep the check on interleukin 1. Do not want too much osteoclast activation. So in men, it is testosterone that keeps interleukin 1 in check. In women, we should keep the estrogen. In women, estrogen the level they keep a check on interleukin 1. But in men, the testosterone keep a check in interleukin 1. Okay. So push inhibitory effect on interleukin 1 release from osteoblast after PTH hooks in. Therefore, in women, can see why they get osteoporosis because less of oxygen. Interleukin 1 not in check and breaking more bone down than making. This is the mechanism postmenopausal osteoporosis. PTH is more involved in maintaining calcium levels in our blood, while vitamin D is more involved in mineralizing our bones and cartilage. Vitamin D deficiency. Let's read around vitamin D again. It's very important, but too much information in there. Well, again, sex hormones keep the interleukin 1 in check. Now, to talk about vitamin D, but they involved with PTH, involved with interleukin 1, involved with the sex hormones, involved with the or involved with the osteoclast, calcium. Oh, vitamin D involved with so many things in the body. Again, vitamin D na involved PTH na right? Involve BTH, involve calcium, which involve osteoblast, osteoclast, involved with the interleukin-1, involves with sex hormones, estrogen, testosterone, so many things like that. Okay, interleukin-1 to keep in mind how vitamin D, very important. Sex hormone keep interleukin-1 in check. In woman, estrogen, they will keep the interleukin-1 in check. In men, the testosterone keep interleukin-1 in check. Okay, but in check for what? In woman, do not want too much osteoclast activation, which we don't want too much osteoclast activation, which we don't want too much to break down the bone. In men, which is keep interleukin-1 in check, which puts inhibitory effects on interleukin-1 release from osteoblast after PTH hooking. In women, they keep in check by they do not want too much osteoclast activation. So then also they stand for which is the inhibit activation of the osteoclast, right? So not breaking the bone. And in men, which is they inhibit effect of interleukin-1 release from osteoblast after PTH hooking. Therefore, in women, can see why they get osteoporosis, lack of estrogen, interleukin not in check, and breaking more bone down than making, breaking down more than making. So that's why cause osteoporosis. So that's a mechanism of a postmenopausal. So then involved with vitamin D now. So if like that, I need to get out more, get sun now. Important. PTH is more involved in maintaining calcium levels in our blood, while vitamin D is more involved mineralizing our bones and cartilage. PTH more involved with maintain calcium level in blood, while vitamin D is more involved with the mineralizing in bone and cartilage. So vitamin D, fish oil, vitamin D, very important, huh? Now, vitamin D deficiency, many reasons, like a lack of sun, poor diet, or liver disease, or renal disease. So if like that, we give the supplements of vitamin D, fish oil, multivitamin for patient, very important. Example, patient on phenytoin and patient has hypocalcemia, while phenytoin is a patient in phenytoin patient have a hypocalcemia. While phenytoin alcohol barbiturates revamping on induce cytochrome P450 system located in smooth, SER. Therefore, get SER hyperplasia. Therefore, you metabolize drugs and other things make in the liver, inducing 25 hydroxy vitamin D. Therefore, anything that rev up the P450 enzymes will cause a decrease in vitamin D and any other drugs being taken. Example, woman on birth control pills and taking phenytoin, she got pregnant. Why? The phenytoin rev up the P450 system will increase the metabolism of estrogen and progesterone in the birth control pills, therefore not enough levels to prevent pregnancy. Example, what is the enzyme in the SER that increase when P450 is revved up? It's a gamma glutamyl transferase, which is GGT. GGT, enzyme SER, locate in the alcoholics involved with the GGT, huh? But nowadays they change, they say LGBT, so LGBT, something like that, in the liver enzyme. Keep in mind, which is a GGT. Example, most common cause chronic renal disease in USA, diabetes mellitus, tubular damage. So no 1-alpha hydroxylase, therefore inactive. Vitamin D, therefore patients with chronic renal failure are put on 125 vitamin D. Example, if someone gets over-the-counter vitamin D, what steps does it go through to become metabolically active? 25 hydroxylated in liver and 1-alpha hydroxylated in your kidney. It is not 125 vitamin D. This is a prescription drug and extremely dangerous. So many people have a misconception that a vitamin D is already working. This is not the case. Patient must have a functioning liver and kidney. Example, if someone gets over-the-counter vitamin D, what steps does it go through to become metabolically active? The 25 hydroxylase in liver and 1-alpha hydroxylase in kidney. This is not 1-alpha vitamin. It's not 125 vitamin D. This is prescription drug and extremely dangerous. Many people have a misconception that vitamin D is already working. It's not the case. Patient must have functioning. Oh, so then if we buy the over-counter vitamin D, that not necessarily mean become 125 vitamin D yet. To make sure your liver and your kidney work properly, they can convert vitamin D, okay, to the good thing, to the correct thing, so if my liver or kidney not function properly, then cannot convert the over-the-counter vitamin D to the doable, usable vitamin D for the body usage. Keep in mind that with vitamin D deficiency in kids, they call this rickets. Vitamin D deficiency in adults, we call it also Malaysia, which is types. Malaysia stands for soft. Okay, this also bones, so soft bones. So if you can mineralize bone, so if you cannot mineralize bone, you cannot mineralize cartilage. Or remember how they say PTH, which regulate the calcium level in the bloodstream. But vitamin D, which is the function of it, is mainly in the mineralized thing, cartilage. If you cannot mineralize bone and cartilage. If you cannot mineralize bones, then you cannot mineralize cartilage, and they will both be soft. Therefore, pathologic fractures are common. So kids have a few things that are different in rickets. For example, craniotopes, soft skulls, soft skulls can actually press in and it will recoil. They can also get rickets rosaries because the osteo is located in the coastal control junction and because the vitamin deficiency, there is a loss of normal osteoid waiting to be mineralized, but not an appropriate calcium phosphorus solubility product. We have excess osteo with a little bumps, so which is called ricket, the grocery nothing in adults because they are getting fused. Kids have different few things different in rickets. For example, craniotopes, soft skulls can actually press and it recoils. Oh man. They also get rickety groceries because the olive oil is located in coastal control junction. For example, the reefs have a coastal control junction there. So, and because they are vitamin D deficiency, there is a loss of normal cell waiting to be mineralized but not appropriate. So calcium phosphorus solubility product, you have excess osteoid with the little bumps, which is called this rickety rosary. Oh, nothing in adults because they get fused already. But in kids, in children, we saw that. So two things can seen in the kids, but not in adults. Number one, craniotopes. Number two, which is rickety groceries. So pathology fractures being the main problem. Now toxicity, vitamin D. Thì then vitamin D, high vitamin D and high calcium in the bloodstream. So hypercalcemia, therefore risk of having too many stones in the urine, and stone is the most common cause complication. Type 1 rickets, which is L1 alpha hydroxylase. Type 2 rickets, which is missing receptor for vitamin D. Okay, now talk about vitamin E. Main function, maintain cell membranes and prevent lipid peroxidation of the cell membranes. In other words, it protects the cell membranes from being broken down by phospholipase A. So lipid peroxidation, which is free radical damage to the cell membrane and is prevented with vitamin E. Other function, neutralize oxidized LDL, which is far more atherogenic than LDL by itself. When LDL is oxidized, it is way more injurious to the cell than when it's not oxidized. Vitamin E will neutralize oxidized LDL. Therefore, it's a cardioprotectant. Vitamin E and C both neutralize oxidized LDL. In summary, vitamin E function, she protects cell membrane from free radical damage. Number two, oxidize free LDL, which is LDL that macrophage phagocytose to produce foam cells and leads to atherosclerotic plaques. So number two, which is oxidized free LDL. Free LDL, this is LDL that macrophage phagocytose and create a foam cell and cause the atherosclerotic plaques. So this vitamin E very important. They oxidize the free LDL. So deficiency in vitamin E is seen, but very uncommon. Very uncommon deficiency. And if keep in mind this fast soluble vitamin so far, ADEK, alphabet, ADEK. Deficiency vitamin E is seen, but it's very uncommon. And if seen, it would be in kids with cystic fibrosis from birth. Kids have respiratory problems and pancreas problems. Look at in Robin's too. So Robin pathology. A kid that has a cystic fibrosis will have a malabsorption problems. Therefore, what four vitamins should you give him? So cystic fibrosis patient so has a malabsorption of fat. Therefore, they will have a malabsorption of fat soluble vitamins IDEK. Vitamin E deficiency usually seen in cystic fibrosis patient. So not very common to see vitamin E deficiency, except cystic fibrosis. This happened in USA in patient. Again, not very common since if the kids with the cystic fibrosis, okay, from birth. So birth kids have a respiratory problems and pancreas problems. Look at in Robin as well. Okay, look in the pathology, Robin. Kids that have a cystic fibrosis will have a malabsorption problems. Okay, therefore for vitamin C, you give him cystic fibrosis patient have a malabsorption of fat. Okay. So because cystic fibrosis have a problem malabsorption of fat, so then you need to provide fat soluble vitamin or ADEK. Okay. Clinical presentations. One of the feature of vitamin E deficiency is a hemolytic anemia. Oh, vitamin E normally maintains the integrity of the membrane. This patient is now susceptible to free radical damage. Damaged membrane of red blood cell leads to hemolysis of red blood cell and hemolytic anemia. Oh, keep in mind, huh? Vitamin E deficiency cause which is red blood cell membrane damage, so cause bleeding, so cause hemolytic anemia. Okay, so another feature of vitamin E, there are things related to myelin. Oh, very important, huh? Posterior column disease, spinal cerebellar problems. Therefore, with this vitamin deficiency, vitamin E deficiency, have neurological problems and hemolytic anemia. Neurological problem because damage myelin related myelin cause posterior column disease, spinal cerebellar problem. Therefore, with vitamin E deficiency have a neurological problems and hemolytic anemia. Vitamin E toxicity, anything more than 1,100 units. Average capsule is 400 units. Keep in mind this is vitamin E, huh? It's not vitamin D. Okay, D which they allow some thousand. Vitamin E, if I use too much, more than 1,100 units. Every capsule which is 400 units. Therefore, if take 3 pills already toxic, oh man, that's dangerous, huh? Vitamin E toxicity will inhibit synthesis of vitamin K. Oh, they involve, man. Vitamin K dependent coagulation factors, which is 27910. Remember that 27910, 2790. Protein C and S as well. So vitamin K dependent coagulation factors, which is 27910 and protein CS. So if my vitamin E toxicity is too much vitamin E, they will inhibit synthesis of vitamin K dependent coagulation factors, which is 27910 protein C and S. Oh, very important, very, very important. In other words, you are anticoagulated, which is bleeding easily with anticoagulation. Example, patient with myocardial infarction take antioxidant and aspirin. With anterior myocardial infarction, they anticoagulate the patient. The patient go home 3 months of warfarin. Normal I and R ratio and test loss or lost vitamin E and other vitamins. Take a lost vitamin E will help warfarin because anticoagulation reaching over anticoagulation state. Remember that warfarin blocks gamma carboxylation of vitamin K. the depreciation factors. Vitamin E will prevent the synthesis of these factors. Therefore, vitamin E toxicity, which is active warfarin, example based on warfarin. So if scenario, uh, so patient, for example, chỉ là mild current patient, and patient use warfarin, and use warfarin, and then INR ratio high. Reason why? Because at home patient take too much vitamin E. Oh, keep in mind, everything involved. Vitamin K sources can come from what we eat, but most is synthesized by our colonic bacteria. Vitamin K, which is synthesized from colonic bacteria, uh, come from what we eat, but most is synthesized by colonic bacteria. Our anaerobes in our gut. This is why we give vitamin K injection to our baby when they are born. They only have a 3 days worth of vitamin K from mom, but after that they won't have any. Oh, they only have a 3 days worth of vitamin K from mom, but after that they won't have any because it's not in breast milk. Therefore, very low level of vitamin K between day 3 and 5. Oh, they only have a 3 day worth of vitamin K from mom, but then after that no more. So that's why we give vitamin K injection to our baby when they were born. Okay, remember that. So after 3 days, then they don't have a vitamin K. So well, they only have a 3 day worth of vitamin K from mom, but after that they won't have any because not in breast milk. So in the milk, in the breast milk doesn't have vitamin K. Therefore, very low level of vitamin K between day 3 5. So that's why we need to inject vitamin K for the baby. They don't have a bacteria to make vitamin K yet. Therefore, can get hemorrhagic disease of the newborn. So this is why we give vitamin K when they are born. After 5 days, the bacteria colonize. Vitamin is made by the baby. Oh, that's amazing! Great, 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 great. Metabolism. Bacteria makes vitamin K in an inactive form. Bacteria make vitamin K in an inactive form. K2. Bacteria make vitamin K in active form K2. K2, this inactive form must be converted by epoxide reductase to K1. K1 is the active form of vitamin K. K1 will gamma carboxylase the vitamin K dependent factors, which is vitamin K dependent factor, which is 2, 7, 9, 10, and protein CS. So gamma carboxylase requires the same understanding as vitamin C. So in vitamin C, if you don't hydroxylase proline and lysine, then the cross links are weaker anchor protein. Gamma carboxylation of vitamin K dependent factors usually activates them to become functional. Vitamin K dependent factors all have something in common. So have to be activated by vitamin K1, and number 2, they are the only coagulation factors that are bound to the clot by calcium. So they have to be bound by calcium in order to work and form the clot. If you cannot bind, then you are anticoagulated. That's what gamma carboxylation. Glutamic acid residues are gamma carboxylated on the vitamin K dependent factors, which is done with vitamin K1. and allows calcium to bind the factors. Therefore, it keeps them together and you are able to form the clot. So therefore, if they are not carboxylated, they are useless because calcium cannot grab them to form the clot. So gamma carboxylation is the anchor protein. So calcium can bind to form the clot, similar to hydroxylation of proline and lysine in collagen synthesis. Warfarin blocks epoxide reductase. So all the vitamin K patient has is K2. And no gamma carboxylation will occur. Therefore, the patient is anticoagulated. Vitamin K deficiency. Most common cause vitamin K deficiency in hospital is a broad spectrum antibiotic. Second most common cause of poor diet being newborn malabsorption. Most common cause vitamin K deficiency in hospital which is antibiotic. Second most common cause with a poor diet being a newborn malabsorption. Deficiency vitamin K which is hemorrhagic diathesis bleeding into skin or brain. Oh, deficiency vitamin K. Knowing why newborn has vitamin K deficiency. Remember vitamin K synthesis from colon. Knowing why newborn have vitamin K deficiency. Example, kid with a rat poison or rat poison, which is a warfarin. When rats eat it, they get anticoagulation and die, which is bleeding to death. So treat with the intramuscular vitamin K. Example, kids live with the grandparents and develop hemorrhagic diathesis. Why? Because the elderly were on warfarin. The kids ate the warfarin and led to toxic levels. Oh man, keep in mind here. For example, in the patient, if I have an elderly, if doctor give the warfarin, but then after that the kids thought candy, whatever, and eat the warfarin, and then after that cause hemorrhagic diathesis. That can get into, you know what I mean? They're very dangerous. Can lead to toxic level. Patient with the periorbital hemorrhage from vitamin K deficiency related warfarin. Chưa mới warfarin. Oh, bleeding easily rồi đó. Newborn brain hemorrhagic disease. Newborn from vitamin K deficiency. Okay, maybe done here. Ui, ui, ui.